Question, the member from London West.
Thank you, Speaker. My question is to the Premier. Speaker, London's Cardiac Fitness Institute is a long-term cardiac rehab program slated to close at the end of this month. London CFI patients have told me that if they had not enrolled in the program after their heart attack, they would not be here today. Not only does CFI help patients recover from a cardiac event, it helps them maintain their health, with support from healthcare providers and other patients who know exactly what they are going through. The Premier and her Minister of Health have defended the closure of CFI, saying that 6 months of cardiac rehab is all that is needed, that there is no scientific evidence to prove otherwise. Speaker, does the Premier stand by this explanation?
Minister of Municipal Affairs is warned. Finish your question, please.
Does the Premier stand by this explanation, this defence of the closure of the CFI?
Thank you, Premier.
Mr. Speaker, and I thank the member opposite for the question, and I know that the Minister of Health and Long-Term Care is going to want to comment on the specifics of the program. But let me just say this, Mr. Speaker, that it is extremely important, given that the healthcare system, I think, is the finest expression of our values as a province, and that's a nonpartisan statement, Mr. Speaker. I think all of us believe that the healthcare system that supports everyone is an expression of Ontario values, Canadian values, Mr. Speaker, and that it needs to be fair and accessible to everyone, and that it needs to do the very best job, Mr. Speaker, to have the highest quality in every single sector, Mr. Speaker, whatever the illness, whatever the condition of patients is. Mr. Speaker, it also has to be based on evidence. We have to use evidence to inform the practices in our healthcare system. Otherwise, Mr. Speaker, we are cut adrift, and there's a randomness that really will make healthcare unsustainable. So we are using evidence, Mr. Speaker, to the best of our ability. And
Thank you. Supplementary.
Thank you, Speaker. Speaker, not only is there British evidence to prove otherwise, but yesterday media reported on a recent Ontario study that says the more cardiac rehab care that patients receive after a cardiac incident, the longer they live. The study was about Healthy Hearts, a cardiac care program in Goderich that was modelled after the CFI. The researcher who conducted the study said the London cardiac rehab program should be placed on a pedestal instead of being torn down. Speaker, why is the Premier tearing down a program that has helped so many Londoners, prevented use of our critical care system, and inspired groundbreaking scientific research?
Thank you.
from long-term care.
Minister of Health, long-term care.
Thank you very much, Mr. Speaker. And our government is absolutely committed to ensuring that patients in Ontario receive the high-quality health care, including, in this case, rehabilitative care that they expect and deserve. And as the Premier has said, we are a government that absolutely believes in evidence-based decision-making. We are the government that introduced measuring outcomes, which, quite honestly, was not done in the past at all. So, the London Health Science Centre has made the decision to end patient referrals to the Cardiac Fitness Institute, but we're absolutely confident that patients in London will continue to receive cardiac rehabilitation care through the programme at St Joseph's Healthcare London. This St Joseph's, as I'm sure the member opposite knows, specialises in rehabilitative care. It's exactly the right place where these patients should be receiving the care that they need.
Yes, sir.
There will also be services available that will be continued to offer through the cardiac rehab and secondary prevention program that is also available in London.
Final supplementary.
Speaker, Bill Anderson is a World War II veteran who turns 96 this week. He will be heading to Northern Ontario next week to celebrate his birthday fly fishing with his friends. He told media that he has been in the Healthy Hearts program for 21 years after suffering 2 heart attacks, and that he probably wouldn't be here today without it. There are many, many Londoners who feel exactly the same way about the CFI. Speaker, the evidence is there to support the continuation of the CFI program. Why is the Premier not there with the funding necessary to keep this life-saving, life-changing program running at London Health Sciences Centre?
Minister.
Well, thank you, Mr. Speaker, and we're certainly going to be working very hard on the transition of patients to St. Joseph's. In terms of the scientific evidence, we are saying 6 months of cardiac rehabilitation. It's actually a fact that the Mayo Clinic only recommends 3 months. The American Heart Association recommends 3 months, and across the province we provide 6 months. Now, is it always important to increase physical activity, to have a healthy lifestyle? Absolutely, going forward. And the member opposite did reference the Goderich Healthy Hearts program. Now, this is a program in Goderich that is run by the YMCA, a much more appropriate setting than an acute care hospital. And of course, this is something that is funded on an ongoing basis, not by the government, but by the participants in the program. This is entirely appropriate. This is post-acute cardiac rehab. This is the way we should go in terms of consolidating services at St. Joe's.